According to the World Bank, Kenya has a varied climate. It is hot and humid in the coast, temperate inland, and arid or semi-arid with minimal rainfall in the northeast. However, Kenya has multiple vulnerabilities to climate change. The country may likely see an increase in the intensity of floods common to the region alongside changing temperature and rainfall patterns. Such climate-driven events will impact on the recent gains in social development and public health. The risk of malaria and other waterborne diseases are projected to increase in future years due to the changing climate conditions. More severe and frequent flooding may displace marginalized communities and increase the risk of waterborne diseases, exacerbate incidences of female genital mutilation, and higher temperatures may threaten food and national security, agricultural livelihoods, and increase heat-related deaths in the elderly.
Kwanza tangu mimi nikiwa mtoto mpaka wakati huu, kuna mabadiliko mengi ambaye yamejitokeza. Kwa mfano mbeleni ama miaka zingine za nyuma kulikuwa na mvua. Kuna ile mvua ya kwanza na kuna ile ya nyuma, na zote huwa inapatikana kwa muda unaofaa. Sasa wakati hiyo kulikuwa na nyasi mingi na kulikuwa na hatukuwa na shida, maana tulikuwa na maziwa. Lakini kufikia hizi wakati ama nyakati ambayo tuko sasa, kuna mabadiliko. Kwanza hata upande wa mvua haikuji kwa ile wakati ambaye tulikuwa tunapata. Inaenda nanga na misimu. Saa nyingine tunasema tunalima. Na tunalima ile wakati ambayo sisi tunajua mvua inakuja. Sasa tukilima mvua ikuji yenye sisi tunatarajia. Katika afya inatuathiri kwa sababu tunakosa chakula, na unajua tukikosa chakula afya yetu inasoroteka kwa sababu hatushibi, hatupati chakula ya kushiba. Unakuta watoto wameanza kuwa na ile semekana watoto wako na kwashoko kwa sababu hawakuli chakula nzuri, hawapati chakula nzuri. Na maji pia tunakosa, juu zile chemchemi zote za maji zinakauka. Kiangazi ikiingia hakuna maji. So na tena inakuwa ile vumbi yote inaamuka, kila saa tunapata mahoma kwa sababu ya hiyo vumbi.
Tunategemeanga sana ng'ombe. Sasa kiangazi kikuja tunaweza hamisha, sikufe, zinakufa. Tunakuja sasa nyumbani na affect wasichana kwa sababu msichana akikuwa mdogo tunatairi. Sawa, tukimtairi ana nini, tunapeana sasa ndio tupate sisi turudishe hiyo livestock yetu, ndio tukue na ng'ombe kidogo.
With a growing understanding of the human cost of a warming climate, the need for adaptation measures to protect health is now more important than ever. The COVID-19 pandemic makes clear the challenges faced by health systems around the world, resulting from large unexpected shifts in demand without sufficient adaptation or integration of health services across various sectors. As this public health crisis continues and is compounded by climate-attributable risks, rapid and proactive interventions are crucial to prepare for and build resilience to both the health threats of climate change and of pandemics.
Climate change due to increased greenhouse emissions causes about 150,000 deaths annually due to extreme weather events such as heat waves, flooding, droughts, among others. The direct cost to health is projected to be about $2 to $4 billion per annum, and this is expected to increase drastically by the year 2030. Developing countries, particularly those in sub-Saharan Africa, where most populations are dependent on climate-sensitive economies, besides bearing the heavy burden of communicable diseases, weak health system, and high poverty levels, are most vulnerable. Climate change, compounded with the effects of health, is likely to affect community health resilience, and if not addressed, will likely push the populations into deeper poverty pockets.
We cannot have a sustainable future without climate resilient and healthy societies. We all have an enormous role to play in the collective quest for public health by defining our climate actions, objectives, allocation of resources, mobilization of stakeholders, and accountability. This is why AMREFT Health Africa in Kenya, the Ministry of Health, and Kenya Climate Innovation Center have come together to champion research, innovation, and partnerships in line with what we believe will confer direct benefits to enhance community health resilience by expanding and deepening partnerships among stakeholders, mainstream participatory community health resilience approaches, and finally, employing a gender perspective in climate change and health response to accelerate health equality and equity both between and within populations.
Indeed, climate change is a big threat, to our health systems. And this is because climate change have affected social and environmental determinants of health. Here I'm talking about clean air, I'm talking about sufficient food, I'm talking about even shelter. And also at the same time, it's also issues about, the heat that we have seen as a result of climate change. And indeed, all these things put together is that they are overwhelming our health systems. We've seen more diseases, we've seen more malnutrition because of lack of sufficient food. And at the same time, indoor house pollution still contributes, to some of the diseases that we've seen in the recent past. And when you look at it all together, it's an issue about the effects of climate change to the health systems in our continent of Africa.
The first initiative was to designate a unit responsible for climate change. So that time it was a unit called the Waste Management Climate Change. Now it is a division of Waste Management, Climate Change and Pollution Control. And then also to form a coordinating mechanism which we call the Technical Working Group on Health. At the Ministry of Health level, we are partnering with the Ministry of Energy with support from World Bank to do solar. Have a solar, off-grid solar access to 800 plus health facilities in the whole country.